And let's quickly now go to our big spotlight story on 5 Live. The Kerala model, the big fight over the much vaunted and praised Kerala model on COVID at a time when Kerala is leading India into the third COVID wave. Take a look.
Monstrous COVID surge in God's own country. First state with over 20,000 cases in 50 days. Kerala accounts for 50% of India's COVID caseload. Centre rushes high-level team to Kerala. Is Kerala paying the price for festival appeasement? Top focus on 5 Live.
Look at the COVID numbers in Kerala right now, ladies and gentlemen. Over half of India's total COVID daily cases is coming from the state of Kerala, leading many people to wonder, why isn't this a bigger deal? Why aren't people showing the same amount of outrage? Is there some kind of selectivity at play here? Take a look at the numbers. I'll decode it for you because it's not a black and white issue. Cases in the last 24 hours, 22,056 in Kerala. Deaths in the last 24 hours in Kerala, 131. Recoveries, over 17,000. A positivity rate of 11%. These are figures on July the 28th, the last 24 hours. Let's take a look at the 5 top developments in Kerala's massive COVID spike, because people are wondering, what was that Kerala model all about if Kerala is clearly leading India into the third wave? The centre has rushed a 6-member high-level team to Kerala to take stock in the wake of this massive COVID spike reported in the state. The team will be working closely with the state health departments and recommend health interventions to contain this sudden explosion in cases. This is the lull between the second and the third wave, and Kerala is number 1 on the list in terms of daily cases. The deployment of the 6-member team to Kerala comes a day after the Modi government wrote a strongly worded letter to the Kerala government to strictly contain this infection from spreading in view of certain super spreader events in the state. We'll come to that in just a moment. Well, as the COVID cases continue to spike, the Pinarayi government has decided to continue weekend lockdowns in Kerala. Restrictions and relaxations will continue at this time as well. Politics over the Kerala COVID spike continues, with the BJP slamming the Pinarayi Vijayan government for allowing 3-day relaxations ahead of Bakrid earlier this month. The Saffron Party has accused the CPM government of appeasement politics over saving human lives. Amidst all this criticism from the opposition, the Kerala government has been flagging vaccine shortages in the state. Health Minister Veena George, who replaced the famous Shailaja, who was responsible for the Kerala model praise, on Wednesday, Veena George said that vaccine drives would be cancelled as 13 out of 14 top districts have simply run out of vaccine vials. Considered to have the best healthcare system in the country, and for good reason, Kerala is now failing to live up to expectations during the first wave. Here's a report by India Today's Deputy Editor Sneha Mordani on why cases are surging in Kerala according to the central government's assessment, and why the need has been felt to rush in a crack team to God's own country.
The state, once touted for controlling COVID effectively, keeping deaths at a low and sending healthy people back home, is now in the news for all the wrong reasons. Kerala now accounts for 50% of COVID-19 cases in India.
अगर आप देखें कि देश में आज भी चाहे केसेस कंसंट्रेटेड मैनर में पाए जा रहे हैं, लेकिन अभी भी देश में 22 ऐसे जिले हैं जहां पर कि पिछले 4 हफ्तों में हमने एक इंक्रीजिंग ट्रेंड इन केसेस नोट किया है। हमने आपको दर्शाया है स्टेट वाइज ऐसे कौन से जिले हैं जहां पर कि वीक ऑन वीक बेसिस पर अगर हम देखें तो पिछले 4 हफ्तों में केसेस में संख्या में वृद्धि हुई है। यह वृद्धि एक मान लीजिए कि लिमिटेड नंबर ऑफ केसेस से थोड़ी भी वृद्धि है तो यह कॉज ऑफ कंसर्न है, जिसके लिए हम स्टेट से डिस्कस करते रहते हैं।
A drastic increase of cases has been seen in the last 4 weeks. Documents accessed by India Today show Kottayam has seen almost 64% increase in cases in a month. Malappuram has seen a 59% jump in cases. Thrissur recorded a 45.4% rise during the same period, and Ernakulam has seen a 46.5% increase.
India Today has accessed this letter that has been written by Union Health Secretary Rajesh Bhushan to the Kerala government, talking about the fact that the central team that visited Kerala in the first week of July has made some observations about what really is going wrong in the state. Containment has to be improved in the state of Kerala. This letter also talks about the fact that certain super spreader events have been witnessed in the state of Kerala, which has clearly led to the spike.
In his letter, the Union Health Secretary says Kerala needs to do more in terms of containment. Home isolation cases, currently accounting for 95% of the active cases in the state, need to be done as per the guidelines of the Union Health Ministry. Bhushan also points out that between July 10 and 19, Kerala has seen a spike of 91,617 cases and 775 deaths. The centre says ramping up vaccination and reducing wastage is needed. Higher test positivity of 10.5% may require more stringent measures and restrictions. The centre says another problem in Kerala is non-adherence to COVID-appropriate behaviour among migrant workers. It says some positive patients have refused to get admitted to isolation centres and they need counselling. The centre has already sent a team to Kerala to review the situation in the first week of July. A team is being sent again. With Sneha Modani, Bureau Report, India Today.
Now here's why the Kerala surge is worrying. Certainly there is nuance. It's not a simple black and white issue, but there are some legitimate questions that need to be asked about all the praise that went to the Kerala model. But that was during the first wave. Now we're talking about the lull between the second and the third wave. Reasons to worry. Number one, very high number of cases may lead to the third wave, which it in fact is doing. Two, it indicates the possible presence of a new variant. This isn't confirmed, but there is always that possibility, and India has seen that happen. Number three, it confirms low community immunity rates, because the fact is people are still testing positive, so immunity rates are still low. Four, it shows that the state has been lax perhaps in restrictions. The government even went to the Supreme Court trying to fight its decision to relax the lockdown restrictions ahead of certain festivals. Number five, it shows that super spreader events could still potentially be active and out there. Number six, it establishes that flouting of COVID safety norms is definitely happening. How else could there be such a large volume of spread? Number seven, it confirms less impact of triple lockdown. There was a triple lockdown within a lockdown in Kerala, but the impact of that apparently has not been felt, or there's something that isn't meeting the eye. Sneha Modani, who broke the story yesterday about the centre assessing that things are bad enough that they are sending a crack team down from the centre to Kerala to take stock and conduct an intervention, is with me live. Sneha, the central team rushed to Kerala to assess the ground situation. What are the latest details that you are picking up on what this team specifically is going to do?
Well, this is a high-level team that is being sent to Kerala, and this team is going to be reaching tomorrow. It is being led by the National Centre of Disease Control Head, who is Dr. Sujit Singh. So in every sense, it is a high-level delegation that's going to be in Kerala, and it's going to be visiting a couple of districts. Districts of concern, about 7 of them in Kerala. So in totality, there are 22 districts in all over the country that are seeing an extremely high surge in cases, and weekly assessment is that the numbers that are escalating to the level that is not acceptable. Kerala has 7 such districts. Malappuram, for example, also Kottayam. Kottayam, let me tell you, has seen about a 64% increase in the last 4 weeks or so, as per the data that the Health Ministry has with us. The problem there is, what we are being told is that the effort towards containment is clearly not satisfactory.
You know, Sneha, the COVID epicenter that Kerala is becoming is struggling. The state is struggling to cope with this massive spike in daily COVID cases. It is a reality, ladies and gentlemen. This is not a a polarizing issue. Kerala is an Indian state. The fact is that its healthcare system has done relatively well compared to others, but something has definitely gone wrong in the Pinarayi Vijayan government's COVID management that has led to this sudden spike. Amidst this surge, Kerala will be witnessing a lockdown on July the 31st and August the 1st, like every weekend. Kerala continues to account for more than 50% of all cases reported in India. A massive cause for concern, with the state reporting over 22,000 cases for the second day in a row, after a 5-day high registered a day earlier. Kerala has reported over 10,000 daily cases all through July, with a 7-day average of nearly 17,000 cases. Kerala's positivity rate is now over 11%, far higher than the national average. The centre has rushed a 6-member team, like I said, by Director of the National Centre for Disease Control, and urged for adherence to COVID protocol and to avoid mass gatherings. Those gatherings have been taking place and they've been officially permitted by the Pinarayi Vijayan government in Kerala. The government has been pulled up by the opposition BJP over 3-day relaxations in COVID curbs during Bakrid, which it has linked directly to this spike in cases. But is it directly linked to the spike in cases, or has this spike been happening even before these relaxations, is something that is being looked at very closely. Now let's listen to the voices that are coming in on this monstrous COVID surge in Kerala. This is what the experts are saying.
A significant proportion of our population were saved from the severe days of second wave, and now they may be getting infected because the relaxations are there. If you want to prevent infection in Kerala, the only way out is extensive vaccination, massive vaccination, and you have to save maybe an additional 25% of people from vaccination rather than infection.
Yesterday the numbers were about 22,000, and it's hugely disproportionate when you compare the population of Kerala, and therefore I think it's very good that the central team is going there. And I think we just need to really find why the numbers are going up, why it's not come down while nationally the numbers are going down. I mean, because we have an excellent medical infrastructure in Kerala, why is the numbers not going down? It's really a big mystery, and everybody is wearing a mask in Kerala as well.
Now, amidst this steady rise in cases in Kerala, there was a huge amount of anger in different parts of the country over the Pinarayi Vijayan government's decision to actually relax lockdown restrictions in sight of Bakrid shopping. Festival shopping seemed to be a priority for the Pinarayi Vijayan government. Now, whether there is a direct link between the relaxation, the crowds that spilled out to go shopping, and the rise in cases since then is still being looked at, whether there is a direct link or whether this was anyway an upswing in cases happening in Kerala, but it has led to a huge political fight, obviously in God's own country.
Kerala's horrifying COVID spike. Over 50% of India's daily COVID cases. Over 22,000 cases in a single day. Test positivity rate over 12%. 1.5 lakh active cases. A worrying COVID spike in Kerala, breaking all records. God's own country contributing over 50% of India's daily COVID numbers. The state recorded over 22,000 fresh cases on Tuesday, and an alarming test positivity rate at 12.35%. It now has nearly 1.5 lakh active cases, out of nearly 4 lakh in India, triggering fears that the third wave may be already underway in the state.
केरल में 1.2 के आसपास चला हुआ है. Again, it shows that virus replication is going on, chains of transmission are going on.
If you want to prevent infection in Kerala, the only way out is extensive vaccination, massive vaccination, and you have to save maybe an additional 25% of people from vaccination rather than infection.
The fresh spike comes after Supreme Court didn't stop state governments' 3-day relaxations in COVID curbs during Bakri Eid, saying the horse had already bolted. The BJP blamed Vijayan government's Bakri Eid appeasement for the COVID surge and slammed past narratives maligning Kumbh and Kanwar Yatra.
तुष्टीकरण की राजनीति जीती और सुप्रीम कोर्ट के इस हिदायत को केरल की सरकार ने पालन नहीं किया। नतीजा 22,000 केस आज केरल के अंदर आए हैं। हाउ टू प्रिवेंट थर्ड वेव, इस पर पूरे देश में चर्चा हो रही है और यह चिंता का विषय है। ऐसे में व्हाट इज द केयरलेसनेस ऑफ द केरल गवर्नमेंट दैट वी सी सच काइंड ऑफ केस लोड राइज।
Kerala had also relaxed the number of pilgrims for Sabrimala shrine.
Yesterday, Kerala reported 22,129 fresh COVID-19 cases, taking the overall active case lot beyond 1,45,000. So that actually is a significant number, and there are a lot of questions raised against the Kerala model, which was hailed at one point of time during the COVID-19 crisis.
To make matters worse, the state is witnessing a crippling crunch of vaccines. Crowds seeking vaccines are being turned away from jab centers.
The seroprevalence study shows that the number of people infected or the number of people who has antibody in their body is 42%. It means that more than 50% of the total population is unaffected. People of Kerala, they are coming forward to get vaccinated, but the thing is that we don't have vaccine.
The opposition has accused the state government of abandoning the COVID fight.
Day before yesterday, the government distributed 4.5 lakhs after this information was released. Now government is saying that no vaccine is available from the government.
Is the so-called Kerala model of COVID fight failing miserably?
Once acclaimed for its fight against the pandemic, Kerala has now come under fire over the rise in COVID numbers. While the Congress-led opposition demands more transparency from the state government, the BJP has given a political color to this whole scenario. The state expert committee, however, believes that the situation remains under control as the proportion of people who are getting hospitalized are much less as compared to the peak of the second wave. With camera person Tinku Rajshekharan, Gopikrishnan, Thiruvananthapuram for India Today.
Want to bring Sneha back in on this. She's been reporting on that central team headed there. Sneha, what about the festivities in Kerala? Did they turn out to be, super spreader events? Is there any way to track, whether that is true?
Well, as far as the super spreader events are concerned, Rajesh Bhushan's letter clearly, without mentioning Eid, talks about the festivities around Eid, something that the Supreme Court was extremely upset about also, that the period involves Eid as well, the 4-week period that we've seen from June 28th to 27th of July. And the kind of increase that has been seen can be attributed to certain super spreader events. This is a subtle reference to Eid, knowing the sensitivities involved. But this is something the Kerala government has been pulled up by the courts for also clearly. It comes at a time when in North India, the Kanwar Yatra was not allowed. Several states decided to not hold the festival. But Kerala went ahead and did it, for which it has faced a lot of flack.
I have a full special report coming up on the Kundra spawn scandal after this break. But while on the subject of Kerala, take a look at these pictures as we head into this break of Congress workers being water cannoned in Thiruvananthapuram. They've been demanding the resignation of serving Education Minister Sivan Kutti, who faces prosecution in the 6-year-old vandalism case. Big setback for the Pinarayi government, opposition on the warpath.